I'm Dr. Allison with Body Motion Physical Therapy, and we're located here in downtown Edmonds, Washington. And thank you for joining us. Let's see here. Perfect. Cindy is part of the Body Motion team, but her picture hasn't made it up onto this our team yet. But we have Dr. Riley here, Dr. Victoria, Isabel, Devin, myself, and Bucky, and Cindy's also a member of the team here. So you will see them. We always invite everyone to have a free 30-minute consultation with us. If you have like specific questions for yourselves and there's stuff that you don't want to ask on here, and if you're serious about starting your pelvic floor journey, we are happy to help you and happy to be a part of that. So we offer everyone this 30-minute discovery visit. Yeah, perfect. If you guys want, I would love to know, you can keep your screens turned off. That's great. This is being recorded. But if you want to share in the chat, maybe where you're from, if you're postpartum, pregnant, or just excited to learn more about pelvic floor, because maybe you have some incontinence or anything like that. If you want to drop it in the chat, I don't even know if you can, I think you can just message me if you want to keep it private. But I would love that. And I can always, speak to those certain issues as well. So what this is going to look like today is I'll give you kind of a glance of a story. We'll talk about a story that we just see really common. And it is going to be more of a postpartum story. And then we'll talk about how to avoid that. Then I'm going to teach you guys just a little bit about your core. So what exactly is the core, what we're talking about here, and really how to, in the end, I'll give you some tools to like start retraining your core and really tips to help you have a healthy pelvic floor. And then we're going to just go through some myths. So things that people think that are normal and they're not normal. And so maybe you're experiencing them or you suffer from them and you didn't actually know that that wasn't typical. And that's what we hear all the time as well. So then we'll go through a lot of issues that can be related to pelvic floor and how to start healing and some tools to recover. So welcome and thanks for being here. Okay, so I thought I would just start with a story because that's fun. But so here at Body Motion, we help people through fertility, pregnancy, and like really prepping for labor and delivery, and also postpartum. So helping people heal postpartum. And once you're postpartum, like you were always postpartum. We also help people that haven't had kids who have pelvic floor issues. And that's not uncommon either, because people who don't have kids, and a lot of us maybe who are moms have had pelvic floor issues from even before we had kids, because it's just not a talked about subject or topic. And so I'm going to share the story of Leah, and I share this with consent, of course. And it's a postpartum story. So she came to us at 10 years postpartum with severe sciatic pain down her left leg, had gone through traditional physical therapy, tried a couple different physical therapy places, and they just gave her exercises, told her, what to do, and things just kept getting worse. They said, like, you need to just lose weight, and that's going to be like what helps you. And unfortunately, like, we hear that a lot. And she ended up finding us after like pretty much almost giving up, and she had to quit her job because she couldn't even walk anymore. And she was spending she had like 2 hours through the day that she could actually like get stuff done. Her daughter was 10 at the time when she started with us, and she just felt like she couldn't like kayak with her anymore or do anything pretty much. And so she started with us, and she had, after just her discovery visit, we knew exactly what was going on. And she had a C-section 10 years prior. And she like kind of through those 10 years, she was functioning fine, which a lot of people do. But then after so long, your compensations catch up to you. So if your muscles aren't working properly after a C-section or vaginal delivery, you end up having compensations. And when those compensations continue, you end up having pain when your body stops being able to compensate so well. So that was her deal. And her sciatica was from all the scar tissue in her abdomen from her C-section scar. And her pelvic floor was greatly affected as well, which is one of the myths that people hear. And we'll talk about that in just a little bit. And so because it had been 10 years, it did take us 6 months of treatment, but she was able to walk again, kayak again, and she went back to work. And it was just like this beautiful story. And it was all because she had this C-section scar that just no one ever really looked at. And, she had the exercises to do, but she couldn't do them right because she had all this scar tissue from her birth history. And so her sciatica continued. And we just like the story I share is it's her story, and she came to us in like a really severe state, but this is happening all over. And it's like pretty much I went into this field because women after like 10-15 years, our bodies, our compensations that we develop after birth tend to like give way, and we end up with hip pain, low back pain, knee pain. And then once you're in your 50s, you have to like get joint replacements often. And the soliloquy just continues when we could have just like healed the core in the first place. So that's why it's my passion to spread pelvic floor awareness and really just like give this information as much as I can to anyone who will listen, because I think it's that important. And I'm just going to go to the chat here because it's awesome. But that's great. 16 and 18, Seattle, 8-month-old, perfect. And West Seattle, 2-year-old. Awesome. Yes. Definitely not the only one who holds tension in your pelvic floor. That is like tension is held in the pelvic floor. So most moms especially have, stress, a daily level of stress that we just deal with and function with, and like can still have a beautiful, joyful life, but have some level of stress. And we tend to hold that in our necks and in our pelvic floor. And they're very much connected. And so I am grateful you're here. So hopefully you'll learn some relaxation techniques. We'll talk about that at the very end. And so let me talk about the core here. So this is a picture of some core muscles. I'll just go through here. So this is called your transverse abdominis muscle. This is the big, long one. And that is a really important one. And so is the pelvic floor. So is the diaphragm. So when we breathe, we use our diaphragm, we stretch our diaphragm. And then we have some back muscles here called multifidi. Of course, you have like sorry about that. You have your 6-pack ab muscles here, your rectus abdominis, some obliques. So this is considered the core, okay? So when you have a baby, when you're pregnant, this core stretches out. And then all of a sudden the baby goes away. Sorry, that was terrible. The baby's delivered, right? One way or another, that baby is coming out of your body. So you're having a vaginal delivery or you're having a C-section. And when that happens, you have to shrink back, right? Or like that's hopefully what happens is the core comes back together. Well, that process isn't always easy. And typically we have to retrain those muscles how to function. So yes, they can start shrinking back together, but they don't necessarily know how to contract when they should. And that's for the pelvic floor that sits at the bottom, that's for the abdominal muscles, and that's for the diaphragm. So that's part of healing the system. This is a pelvic floor lecture, but they all work together and they're all really, really super duper important. I will also tell you that I firmly believe that the glutes are part of this. So the glutes are your butt muscles, and those butt muscles are so important in helping protect your pelvic floor. So this is the core, okay? So it's important that these muscles are strong, but what creates the strength of the core is actually the pressure in the system. So the pressure that is held within the core. Okay, so I'm going to use a pop can. You'll see on the next slide here. So here's our core again. So here's my soda pop can. I'm not even sure if I'm in the screen. Okay, perfect. So here's my soda pop can. So this is the top. Here's my diaphragm. Here's my pelvic floor, my abdominal muscles, and then some of my back muscles. Okay, so this pop can has some seriously good pressure in it. If I wanted to squish the pop can, I couldn't squish the pop can because it has such good pressure in it. And so, but if I pop the top to my can like this, all the pressure leaves, and now I can like easily squish the can. So part of recovery, postpartum, part of recovery in general. So like even if you have not had a kid, to have like a really strong, good functioning core, we need to have that good pressure. And so that's part of the healing process. And that's part of like getting your muscles to come back together and then teaching how to have good pressure systems. We'll talk a little bit more when we talk about breathing. But hopefully that's clear and hopefully that's helpful to hear. But if you have questions, like drop that into the chat too. And I'm happy to answer those. So that is creating a good pressure through the core. Let's see. All right. Any questions on this? There's something else I wanted to say, and I'm just having total mom brain right now. So I can't think of it. So I'm just going to move on. All right. So these are some of the myths that we hear all the time. So those six-pack ab muscles that you saw, sometimes those are separated during pregnancy. And when that happens, they don't always go back together. Okay. And so a lot of people will think that they need surgery to fix that ab separation, or will just resort to surgery because they don't know of any other option. And or they'll just live with it and they'll just think they like constantly just have this mom belly. Well, that's called a diastasis recti. And there's a lot of exercises and a lot of techniques that you can do to help the belly come back together. So you definitely don't need to have surgery to get that fixed. And there's so much that physical therapy can do. And this is also a pelvic floor issue because when you have separation in your belly, typically the pelvic floor will get even tighter to try and maintain that good pressure in the core, but it like keeps going out through the belly. So you have to train those muscles to come back together. And then that can help restore that really good pressure. Here's what I wanted to say with that. The reason this pressure is so, so important is because when your foot hits the ground, the shock is absorbed through your body. It's called the ground reaction force. And when that is absorbed through your body, you want it to be absorbed through your muscles. Well, if the muscles in the core aren't being very absorptive and you have like a weak can, then what happens is all your joints take up the forces. So maybe, your knee joints are going to take a little bit more, your hip joints are going to take a little bit more. And so your can, which is your core, is not absorbing the forces the way it should. And so when I say like 10 years down the line, so when this continually happens over and over every single day, whatever activities that you enjoy, or maybe it's like someone who likes to run 5Ks or half marathons or marathons, and you're just doing that repetitively, but your core isn't very supportive for you, you tend to just wear out your joints faster and faster, and then end up with a joint replacement or cortisone injections and that whole soliloquy of things, when all it took was like, let's just like get to the root cause of that knee pain, which is just restoring that core, which is the pelvic floor, is the belly, is those butt muscles and the back muscles. So that's where that like pressure becomes really important. Hopefully that's clear. Please, guys, just feel free to drop any questions you have into the chat. So myth number 2 is a lot of people think that if they had a C-section, their pelvic floor wasn't affected. However, anytime that you're cut open in the belly, for a C-section, they have to cut 9 layers of tissue. And some of those layers come down and wrap into the pelvic floor. And so when they sew us back together after a C-section, a lot of times what happens is the pelvic floor elevates and becomes a lot tighter and higher. And that's not that helpful. This is with any abdominal surgery, by the way. So if you had an appendix out, gallbladder surgery, anything like this, any time where anything has gone through your abdominal wall, scar tissue can develop. And this pattern of a tightening around the scar tissue and everything else getting tighter happens. If you think about wearing like a one-piece bathing suit and you have a scar in that bathing suit and then it stitches up and has scar tissue, it's going to pull from everywhere. So if I pretend like I'm wearing, this is my one piece, it's going to pull from everywhere else as that scar tissue develops and becomes like more scar tissue and becomes thicker and thicker. Um, and you heal. And scar tissue is good. I mean, we want to heal, but then once that healing has taken place and everything is closed and good, we need that tissue to let go and move again. So all of our rest of our body can move again. So hopefully that makes sense. So if you've had a C-section, getting pelvic floor therapy is going to be really vital because you want to know how your pelvic floor is, especially if it was an emergency C-section and you were in labor. The baby, will have come down to the birth canal at least somewhat. So your pelvic floor is going to be affected. Myth number 2 is my favorite, leaking pee or incontinence. It's super common, or the myth is that it's normal, and it is definitely not normal. It is super common though. And it's so sad that it just like it becomes almost expected, especially anyone in the nursing home. If you have any older adults in your life, like most likely they are leaking urine, especially if they're women. And I solely believe that the reason they are is they just always have leaked a little bit, and that just progressively gets worse as you get to, 80, 90, like you're in diapers, and it's just that doesn't get better, especially if you're premenopausal too. It's like, or menopausal, it's like great to start to heal that incontinence before all the hormones change. Just because it's a little easier, but it's totally possible, even if you are menopausal or postmenopausal, to start making those changes. They sometimes just take a little bit longer to get the continence back, but getting continence back is something that is so doable, and you don't need surgery to do it. And if you do it without surgery, then you truly have healthy muscles, and you'll rebuild that soda pop can and create a really good pressure. And once you know how to maintain that good pressure, it's easy to maintain. It's not like you're doing 500 exercises for the rest of your life. And we don't talk about Kegels really in this office. I'll bring it up in the end. But most of the time, we're giving people an anti-Kegel diet because you don't need Kegels to help restore this good core pressure. So that's my incontinence myth. I'm in this fitness group right now, and there's like a whole post about incontinence leaking when they were doing like jump ropes was one of the exercises, and everyone's like, oh yeah, I'm just peeing, and what should I do instead? Or I don't care that I pee. And really, like, it's fine if, like, some people are like super okay with peeing their pants, and some people are really, really embarrassed about it. But all that matters is like, we know that there's probably something wrong with the pelvic floor if that's happening. And that means your entire core system isn't functioning well. So it's like, get to the root cause of that. So jump ropes aren't hurting your knees or hurting your hips or ankles, really. So that's my spiel on incontinence. Another myth is that sex is painful after kids. And it definitely doesn't have to be, and it should not be. There's a lot that you can do to help with that. And sex should be pleasurable. And the more that like sex is uncomfortable, and for a lot of people, sex is uncomfortable before kids too. So it's not that it's just a after kids thing. There just tends to be more scar tissue after kids that makes it even that much more uncomfortable. But this is still definitely should not be. You should be able to have orgasms, be able to have sex, all without pain and easily. All right, myth number 5 is that there's going to be numbness around the C-section scar. A lot of times it's the scar tissue itself that's entrapping the nerves from regenerating the sensory nerves. And so we want to get that scar tissue moving as quickly as possible, and that can help get the sensation back more quickly. And just in general, some people will always have some sensory issues if a sensory nerve was nicked or just dies, I guess is what I would say. But most of the time sensation can come back, especially if the scar tissue is dealt with pretty quickly after C-section. Myth number 6, we hear this all the time, and this is just kills me, but my low back pain will go away if I lose the baby weight or just lose weight in general. And although we want to think that it would be like that easy to like just lose weight and the back pain will go away. Most of the time, it's again because this core system isn't working, and we're absorbing the forces through our spine itself or through the backside. Here I have my pelvis here, through the backside of the pelvis, somewhere along here. This would be called your sacroiliac joints or SI pain, and this would be low back pain. And again, it's just that that core isn't absorbing the forces. And so, and people can have a strong core at any size. So like you could have some, you might think like you're too big to have a strong core, or you just need to lose weight before you can even develop your core, and not true at all. All different sizes can have, all different size people can have really, really strong cores. Um, so another myth, and just something we help people here in the office with. So we hear, this is probably the least well known of things, but pelvic floor really does affect fertility in a lot of ways it can. So one of the things we see is that traditional fertility treatments are sometimes people think that that's the only option. So infertility in the US is considered the inability to conceive after actively trying for 1 year. In every other country, it's 2 years, but in the US, it's 1. And there's so much that the research shows that pelvic floor manual physical therapy, what we do here, can really help with fertility, help with blood flow, help getting the organs moving. And I wrote some stuff here, but really just dealing with inflammation, dealing with adhesions or scar tissue in the pelvis can help with fertility a ton. If you guys have any friends that have suffered with secondary infertility, a lot of times that can be mechanical as well. So just having scar tissue from either a C-section or from the previous delivery can impair subsequent pregnancies, and that's called secondary infertility. So just some more stuff that the pelvic floor not controls, that's not the right word. The pelvic floor issues can be related to. And so painful intercourse, constipation, like I said, knee pain, recurrent muscle strains, recurrent ankle sprains and pain, back pain, neck pain, shoulder pain, you can see the list. But any type of pains, especially after children, like really, there's so much that's happening within the actual core itself. I'll just give you a little, I didn't go through the anatomy of the pelvic floor, which I should because this is a pelvic floor talk, but the bottom of that pop can, so the bottom of that core is your pelvic floor, and the pelvic floor is 3 layers, and it has 3 holes, okay? So it has your anus, your vagina, and your urethra. And so it's urination, intercourse or childbirth, and defecation, so pooping. And so it affects all those. And of course, there's a doctor for every single different hole. But as far as like a pelvic expert physical therapist, we can help you like at least navigate, depending on where you are in your journey, what needs to be treated. So pelvic floor. 3 layers of the pelvic floor now. So clitoris is part of that first layer of the pelvic floor. So if you're having difficulty having orgasm, painful orgasms, or orgasms that happen too easily, or orgasms that don't go away, that would be like some stuff in the first layer, some issues in the first layer. And then second layer is not shown here, but it's more of a fascial layer. So the second layer tends to be the layer that, if you've had a C-section, tends to be the tightest layer or the most problematic layer. If that's the case, a lot of people have more painful intercourse with penetration, but that can happen along with scar tissue pain from childbirth as well. And then we have this deep third layer, and a lot of times this third layer, when we're pregnant, we're working on really stretching this third layer so baby can come through. Some people will not progress during labor, and a lot of times it might be because their pelvic floor, this third layer, was just so tight and wasn't opening at all for them, so the baby just couldn't come down and through the pelvis. A lot of hip muscles, some of these pelvic floor muscles are also considered hip muscles, and so if you're having hip pain or hip problems, a lot of times that can be from the pelvic floor itself. helpful? Hopefully that's helpful. If you want more information, just holler in the chat and I'm happy to do that. Okay, so how to start healing this, healing the core, healing pelvic floor. Number one, see a pelvic expert PT, of course. That is like the most essential thing to do because they can really help guide that process. But I am going to just give you a few things to start with today that everyone should know to really keep their pelvic floors healthy and happy and start your healing journey. Oh, this is like our phases of healing. Essentially, how to start healing your pelvic floor is you want to identify any tissues, identify where there's problems. So whether that's scar tissue from childbirth, scar tissue from an appendectomy when you were 10 or 15, just wherever there's scar tissue in your abdominal wall or inside your pelvis. We get scar tissue too from UTIs, from any inflammation within the pelvic bowl. So that could be STDs, STIs, any inflammation in the pelvis can cause, I won't say will, can cause significant scarring. So that is another thing that can cause scarring that's not childbirth directly. Then we heal those structures. So we manually release them. So when you see a pelvic expert PT, it doesn't always have to be internal work because you can work on these muscles externally. But to get to the deeper structures, a lot of them are internal. So through the vaginal canal, you would treat some of these muscles. And then we teach these muscles how to retrain pretty much. So a healthy pelvic floor opens and closes and should be able to bear down. So hopefully, I don't know if my hands are in the screen. Let me just make sure. So you want to be able to contract, relax, and bear down. So that's the phases of what you want to be able to do. And you can see if you can do that right now. You can squeeze like you're trying to stop the flow of urine. And then you can relax, see if you can let it go. And then see if you can bear down like you're trying to fart, but you don't want anybody to see you fart. And that's the 3 phases that your pelvic floor should do. Whenever you're moving your pelvic floor, you don't want your like thighs doing any work. You don't want your butt doing any work. You don't want your tummy doing any work. You want to make sure that you can really isolate that muscle. And if you aren't able to isolate it, like it's just another great thing to go have a pelvic floor PT look at so you can really see like how this is functioning for your body. Oops. So that's retraining the pelvic floor, retraining the core. We also work on some of the abdominal muscles retraining. And then we work on integrating that with not just core muscles, but work on integrating that with shoulder muscles like the lats, the glutes, all these muscles need to integrate and work together so you can do things like squat, deadlift, because those are just part of daily life activities. And if you can do those right, then that means that when you unload the dishwasher 900 times, well, hopefully not, but maybe you're like me and you have to unload that thing every single day or more and load it, then you're doing it the right way. So you're not like bending over and hurting your back every single time that happens, or twisting and tweaking something. You need these muscles to pattern normally. So when you do those little things like unload the dishwasher or the laundry, that you're not hurting yourself every time. Then we go through a maintenance phase, and that maintenance, that's just part of healing. So maybe you're just, happy with where you're at, and you don't have any of the pelvic floor issues or pains and all that good stuff. And then step 5 is what we see, like when you might need to like tune up your pelvic floor or tune up your core, is if you start training for something new. So it's a new year, right? So people have new goals all the time, which is super great. And so whether you're like training for a half marathon, or you're starting to do swimming or doing dance or Zumba, whatever that is for you, you want to make sure that your core is keeping up with that new activity and your core is able to like manage those changes. So that would be like when you're progressing through life and you have this healthy core already, but you do something new, or you're training for something new, and you just want to make sure that your pelvic floor and your entire core and the pressure system is keeping up to protect you. Cool. Now I blocked that out. Okay, so this is some tools that I'm just going to give you guys to help start creating that healthy pelvic floor. And this is what we give our patients too, just really some basic stuff to start with. So it might seem silly, but I tell you, like, teach your kids all of this. So the very first thing is some breath work. Sorry, I'm going to go back to the chat. Thanks for explaining that. Definitely true for me. Currently going to PT for weak glutes, which is causing my knee pain. Yes, so that's great to hear. So I'm just going to mention too, the glutes. So your buttocks are super important. And people during pregnancy lose their hip extension, so their ability of their leg to come behind their body. And that just naturally gets tighter because of how the babies grow, and we just lose that range of motion. It doesn't necessarily usually come back until about 6 months postpartum, but can take effort to come back. And some people never get that motion back and get their hips extension through their low back. So then that will be another cause of low back pain. However, so because most, like, you hear mom butt all the time, like I have a mom butt, or a flat butt, right? And so a lot of times that happens after having babies because you lose that hip extension. Your glutes aren't working anymore for you. And the glutes are in pelvic floor healing and in core healing. The butt is so essential because the butt pretty much takes the pressure off the pelvic floor. So if you have a really weak butt or a flat butt or whatever you want to call it, that's just aesthetics. But most of the time it means that it's not an active muscle, right? So we'd call it a low tone muscle. So a muscle that's not working for us. Then that means the pelvic floor is going to be doing all that work. And so it's just going to be a really tight muscle. And really tight muscles are weak muscles. And what happens with this really tight muscle is that, like, urine can just flow through, farts can just flow through, gases. So you could be, all this stuff can be just because your pelvic floor is that tight and because you don't have your butt and your glutes unloading your pelvic floor. I'm not saying that that's your problem, but that's just one of the things that we see, and why glute healing and building your butt is so important in pelvic floor healing. Okay, cool. So breathing is kind of trendy now. So I feel like maybe this is, not going to be too foreign, but I'm going to teach you here just a nice, gentle diaphragmatic breath. And I want to tell you what your pelvic floor should be doing when you take this nice belly breath. So a diaphragmatic breath is a belly breath. So you can put your hands on your belly, or maybe one hand on belly, one hand on chest. And if you take a nice deep breath into your belly and let it go, put another one into your belly, keep your hand on your chest relaxed. So you really are just trying to bring that diaphragm. Let's see if I can get a better picture. You're trying to really, when you inhale, your hand should come towards your screen and you should feel like your belly's kind of sticking out, like Santa Claus, if you will. So take a deep breath into belly. You feel it go, and then exhale, the belly comes back in just naturally. That's just a natural recoil when you are breathing. So what happens naturally in the pelvic floor is that when you inhale, so that diaphragm goes down into your belly. The diaphragm goes down into your belly as you inhale. Your pelvic floor should mirror what's happening with your diaphragm. Your pelvic floor should also be opening. Okay. So if you are going to want to start sensing that change. So when you take these breaths, see if you can naturally feel your vulva or your vagina opening a little bit with each inhale. If you can't, then that would be a great, like, starting place. Just start to tune into your body and see if you start to feel that opening. And so that's how important breathing is, and that's how you really start to restore that pressure. So I say do this 5 minutes a day or more, and that's great. Let's see here. Okay. So the other, like, way to really make sure that you're healing your pelvic floor, keeping everything as healthy as humanly possible. Again, this is absolutely one to teach your kids, because kids tend to strain when they poop, and that can end up causing issues later on. So how to have a healthy bowel movement is what I'm going to teach you next. And again, this is all about just like maintaining good pressure in the core, and then also not straining. The reason we don't want to just like strain and poop is because that can make our organs lower in our body. So that can cause more pelvic organ prolapse. So the uterus can come a little bit lower, the bladder inside the vagina can come a little lower, the urethra can come a little lower, and so can the rectum. It can kind of come through, and those can all cause more issues. And so we want to keep everything up in their places. We also want to try and prevent hemorrhoids, or if you were blessed with hemorrhoids during pregnancy, we want to keep those hemorrhoids at bay. And we want to like not create anal fissures or anything like that. So it's so important not to strain when you poop. And if you are straining, or that's the only way you know how to poop or can poop, then that is definitely like you got to see a pelvic PT, because that is something that can change your life for amazingness. Like you want to be able to breathe the poop out is what I say. Okay, so here we go. So how to have a healthy bowel movement. First, your position is, so I'm sitting here. Let me move it away a little bit. I'm going to flex forward just a bit. And the reason I'm doing that is because when I flex forward, it actually straightens the chute for the poop to come through. Okay, so if this is my rectum, it straightens it out. So all of a sudden, I'm naturally just unkinking my rectum. It's called your anal rectal angle, in case anyone cares. Okay, so I'm in this nice pooping position. If you have a squatty potty, that can be great, because that will also create the same effect without you leaning forward. But you want to rest your elbows on your legs. You're going to be here. You're going to take 3 nice, deep, diaphragmatic breaths. So you're going to breathe into your belly and exhale. And you're going to do that 3 times. On the third one, when your belly is full of air, so you're going to, on that third one, you can gently bear down. This is that lengthening of your pelvic floor. And if the poop should just leave your body. Okay. So you can, if you have to, you can just like, it's that little fart move, but it's the fart that you don't want anyone to see. Like it is so small. So that would be the lengthening part. So 3 breaths in. On the third one, that's when you do the little lengthening. And sometimes it might not even take 3 breaths. If you get your stool consistency to a really good point where you can just breathe the poop out, then it might just take 1 or 2 breaths. And really healthy bowel movements should be happening every single day. Constipation is not diagnosed until it's you don't go every 4 days, but really like a healthy bladder, a healthy pelvic floor needs you to have a good healthy bowel movement every single day. And that's something that we can definitely help with physical therapy as well, with pelvic floor physical therapy. So does that make sense, how to have that healthy bowel movement? So position is important. Having good breathing is important. And again, teach your kids, because no one teaches us how to poop. But if you can teach your kids that, you will save them. You will save them some problems later on. Kegels are not to Kegel. Like I said earlier, I kind of gave it away. You don't want to be, Kegels are out of fashion. So if you're going to someone that's telling you to do 100 Kegels a day, that's archaic. No, it has its place occasionally, but you shouldn't have to just Kegel in order to have like a good, healthy pelvic floor. Again, it's all about the pressure, maintaining and building a really good pressure in your core, and you do that through training your muscles. But we want to train our muscles in ways that we actually use them. So that's like squatting or like lifting something, and we have to be able to we have to be able to like use the muscles before we can actually train the muscles. So to just sit there and do Kegels, most likely you're just tightening so most likely you're just like squeezing. If this was my pelvic floor, you're just tightening muscles that are already really tight. So if I was doing bicep curls and I just like continue to do bicep curls, but I was like only moving this much, I would just create like a really bad shoulder and elbow problem for myself. And that's the same thing with the pelvic floor. And that's what we see most of the time is like people are, doing their Kegels, but it's like that's just creating more of a problem because they're just like continually tightening this tight pelvic floor. If you're pregnant or you have friends that are pregnant, and they're doing Kegels and just like repetitive Kegels, that's also not helpful because we want to work on opening the pelvic floor to be able to get that baby out. And so that's really important. And so, yes, don't giggle until you like really know what your pelvic floor is doing and if you need that yourself. I will say that a lot of times clinically, what we see is when people squeeze their pelvic floor, their organs are actually coming down lower. And a lot of times that's because um, they are like pushing down with their Kegel and closing instead of pulling their bladder up, or pulling their rectum up and in. So sometimes Kegels can make things worse. So if you don't actually know what you're doing or where your organs are in your body, and this is why every single human needs a pelvic floor assessment, so you know how to use these muscles because they are so essential to like getting older. So you don't have to be, buying diapers and going down the incontinence aisle at the grocery store. Because the reality is that's a multi-billion-dollar business in America. And it definitely doesn't need to be, because we'd be much healthier if we just dealt with the root cause of the pelvic floor, and getting the core right. So that's that. That's what I have for you. So breathing is the first thing to play with and like really start to get the blood flowing to your pelvic floor. Start visualizing that connection and then really working on pooping. And it's dedication to poop like that every single day. Because when you have an 8-month-old or you have a 2-year-old, like just like, or you have teenagers, like all of it, like it's so we get such in a like go, go, go. It's hard to take the time to poop. And so you really just have to take that time to poop and just like make it a habit that like you're going to sit down, you're going to do your breathing. That's how you're going to poop. And that right there should change a lot for you. And hopefully it will. So, and it should. And so that's the place to start. But I'm happy to answer any questions if you have questions. Hopefully you guys pulled something away that can help you start to like become more aware now. And even if you just like are aware of it, you will start to change and like see changes. So hopefully that is helpful for you. We would love to help you. So Cindy can drop a discovery visit chat request if you're interested in coming in to meet one of our experts. Our doctors meet with people all the time, um, from the area, and we'd be happy to talk with you about like your specific issues and how we can help help you start your healing journey. So thank you for being with me today. It is super foggy here, and at least we don't have rain.
Thank you, everyone. Thank you, Allison.
You are welcome. You can privately chat me too if you just want to ask a personal question too. So.